The next important NSAID is Nimesulide. So for the dosage of Nimesulide is basically come in like one format, which is 100 mg. You can give this 100 mg dose of Nimesulide in two forms, which is the BD form, right? And that's make it 200 milligram a day, right? So the max dose for Nimesulide is 200 milligram per day, and beyond this 200 milligram per day there will be higher risk of GI bleed. So if we increase the dosage of more than equals to 200 mg per day, there will be increased risk alongside if there is some other comorbidities, some other condition which may aggravate the factors, right? Now regarding the onset of action of Nimesulide lies somewhere about 30 minutes, just like other NSAIDs, and it peaks roughly around like 1 to 2 hour, and total duration of action is like a moderate one comparing with other NSAID, somewhere about like 6 to 8 hours. Right, now for the indication. Now before jumping on the indication, let me show you the table for Nimesulide. Nimesulide was having a good analgesic effect. It was having a good uh, antipyretic effect and the moderate anti-inflammatory effect. However, it was still having like lesser GI risk as compared to other drugs in the same list, right? So overall, well balanced uh, NSAID, right? But still, if you want to give this NSAID, we prescribe it alongside with a PPI. So because it was having a good analgesic and antipyretic effect, it is given along with pain, fever, and also a little bit of inflammation you can cover. But primarily and majorly, the pain and fever is covered by Nimesulide. So because of this, there are some other combinations that you can use for the Nimesulide. These include Nimesulide plus paracetamol, the most famous one, right? That is the most widely used. One more thing that I need to tell you that the Nimesulide is actually banned in most of the countries, right? Because of the side effect that it possesses. So let's check the side effects of the Nimesulide. Nimesulide was actually hepatotoxic. In now because the range is so less, right? Like only you can give like two pills, right? Only two pills you can give to the patient, and the patient will reach its maximum threshold before causing its toxic effects, right? And there are also certain other drugs that cause the same thing, but their threshold is large. For example, the paracetamol, right? For example, over here, right, this one, it causes hepatotoxicity like after beyond like 4 grams per day. However, for Nimesulide, it is so less range, 200 milligram. So because of all these things, it is banned in most of the countries. But never mind. If the patient is already having some liver problem, don't prescribe Nimesulide. Okay. Now, so the first combination, Nimesulide plus paracetamol. Now it is also called as Nimulid, Nimulid, P for paracetamol, right? Then there are some other companies also which have the same combination, but their names are different. For example, it can also be like Nice P and so on. Next is Nimesulide. Now, because the Nimesulide actually lacks the anti-inflammatory property, like it has a better analgesic effect, antipyretic effect, but similarly does not have that anti-inflammatory property. So in order to cover that, we combine Nimesulide with a good anti-inflammatory property type of drug, which is the serratopeptidase. So we cover both the things, and this combination is also very nice, right? It is again used for severe musculoskeletal pain, right? Now, next you can give is for cough and flu. right? So Nimesulide, if a patient have fever, cough, flu-like symptoms, you can combine it with phenylephrine or even cetirizine, right? So you can give all these conditions. However, before prescribing Nimesulide, check the patient for any kind of hepatic issues, right? If a patient is like having cirrhosis and some other condition, try not to give Nimesulide, really, right? However, the risk is like beyond 200 milligram per day. So if we need to give the Nimesulide, we need to add a PPI alongside with it. The PPI for Nimesulide is isomeprazole, and you can give like 20 to 40 mg once a day. So if you want to give Nimesulide, add isomeprazole. Hopefully I don't need to remind you again how we choose a particular type of PPI. For choosing a PPI, we need few stuffs, right? All these things that we have already discussed in previous lectures. So right, this was all about the Nimesulide. Next lecture we'll talk about another type of NSAID. So right, this was all about NSAID, and before exiting, I want to remind you it is banned in most of the countries. I don't know why it is still not banned in India, but it is banned in most countries because it is very hepatotoxic. Right, so this was all about Nimesulide.